Welcome back to Rural Health News, this segment of Rural Health Today, where we fill you in on the latest in rural health headlines. We'll cover 3 headlines in today's episode: what's most urgent, a rural health damage report, and a success story to send us into the week. First, what's most urgent? Last week, the medical device company Stryker announced a cyber attack linked to an Iran-affiliated hacking group, causing a global network outage. In a statement, Stryker said the attack was contained to the internal Microsoft environment and had not resulted in any malware or ransomware, but order processing, manufacturing, and shipping has been significantly disrupted due to thousands of Stryker systems being wiped. Hospitals are grappling with the decision to use or replace possibly affected supplies, including life-saving equipment many patients rely on for care. While Stryker has assured hospitals certain products are still safe for use, such as the Mako robot and Vocera communications, the global healthcare industry remains on edge, awaiting further news. On to the damage report. A recent story from KFF Health News features 6 scientists who left or lost their jobs working for the National Institute of Health in the wake of staffing cuts and policy shifts. Let's hear from 3 of these former employees and what they have to say about the new direction of the NIH and the research that has been lost or disregarded altogether. Sylvia Chow, a health communication scientist in Maryland, says she left her NIH job because, quote, work is no longer based on facts or truth, unquote, and the entire system is going backwards rather than forwards. Philip Stewart, an allergy and infectious disease scientist located in Montana, said he experienced so many hurdles in his work last year that it became essentially impossible for him to do his research on tick-borne diseases. He said the remaining scientists at the NIH will continue to experience these burdens and obstacles, and those who haven't been let go are in a very difficult position. Alexa Romberg, a Maryland scientist studying drug abuse, said she left because her work on policies and reducing health disparities was compromised and defunded. Others have cited the politically hostile work environment, funding denials, increasing stress, and the politically oriented decision-making process that developed quickly under the pressure of staffing and funding cuts. This has a significant effect not only on thousands of families affected by job losses, but the state of health research in general and disease management for our entire country. And now for our success story. A Medicaid-funded Missouri pilot program has established social assistance hubs within 6 different rural hospitals. Providers at these hospitals can now refer Medicaid patients to social assistance programs and track their progress through an online program. As a result of this program, providers reported improved blood pressure rates and behavioral health follow-ups from emergency room patients. This is fantastic news because social drivers of health, like access to food and housing, can often be overlooked in healthcare conversations. As we continue to discuss in our new Rural Health Fractured series, the work of healthcare must bridge the divide between patients and necessary access to tailored care. Check out my latest interview with Eva Panetta from the Michigan Health and Hospital Association to hear more on this topic. Thank you to our sources for this episode: Becker's Hospital Review, Medical Device Network, KFF Health News, and the Beacon News.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.